Hi, I'm Lena, and welcome to Super Data JP, the channel where we turn Japan's real estate and cost of living numbers into answers you can actually use. Every video here is built on verified government data, not opinions, and not guesses. Whether you're planning to invest, relocate, or just curious what life in Japan really costs, you're in the right place. Let's get into today's numbers.
Most guides will tell you Japan's national health insurance costs 5 to 10% of your income. What almost none of them mention is that your very first year in the country, that number can drop to almost nothing, and the reason has nothing to do with your salary. First video in our insurance series. 2 videos, 2 systems that quietly protect, or quietly drain, your finances as a foreign resident. Today, national health insurance, and the timing quirk almost nobody explains properly. This applies if you're not covered by an employer's plan, freelancers, students, part-timers below the enrollment threshold, people between jobs, or anyone who just arrived and hasn't started work yet. Nationwide, roughly 970,000 foreign residents are enrolled in this exact system. Your premium isn't one number. It's the sum of separate charges, a medical portion that everyone pays, a late-stage elderly support portion that everyone pays, and a long-term care portion that only applies if you're between 40 and 64. As of fiscal year 2026, there's a new fourth charge, a child and child care support levy, added nationwide for the first time. Every enrollee pays into it, regardless of whether they have children. Here's the number that matters most. No matter how high your income is, there's a legal ceiling. For 2026, that combined national cap is 1,130,000 yen, is almost equal to $6,958 a year, up from 1,060,000 yen, is almost equal to $6,527 the year before. Broken down, 670,000 yen for the medical portion, 260,000 yen for elderly support, 170,000 yen for long-term care, and 30,000 yen for the new child support levy. That's the absolute maximum, and it keeps climbing every year. Below that ceiling, your actual bill comes from 2 building blocks, an income-based levy calculated from what you earned, and a flat per-person levy that applies no matter what you earn. The income-based levy takes last year's income, subtracts a 430,000 yen, is almost equal to $2,648, basic deduction, and applies a rate that's typically 6 to 9% depending on your municipality. There's no single national rate. The same salary produces a different bill in Tokyo than in a smaller city. On top of that, most municipalities charge a flat per person amount, and some charge an additional flat per household amount. This part doesn't care about your income at all, it's billed purely because you're enrolled. Here's what that looks like in practice, using Shinjuku Ward in Tokyo as a reference point for a single person under 40. At an annual income of 3 million yen, is almost equal to $18 for 73, the combined premium works out to roughly 17,900 yen, is almost equal to $110 a month. At 5 million yen, is almost equal to $37.88, it's closer to 33,000 yen, is almost equal to $203 a month. Roughly double the income, roughly double the bill. The income-based levy scales close to linearly. Now here's the part that surprises almost every new arrival. What happens the very first year, before you've ever filed a Japanese tax return? The income-based levy is calculated from your income in the previous calendar year, specifically, income earned in Japan. If you just moved here, that number is 0. Not low. 0. The entire income-based portion of your bill disappears. In practice, that means new arrivals typically pay somewhere between 1,500 yen, is almost equal to $9, and 4,500 yen, is almost equal to $28 a month, just the flat per person portion, and often a reduced version of even that. Back to the Shinjuku example, with 0 prior year income and the automatic reduction applied, the annual bill lands around 16,890 yen, is almost equal to $104, about 1,408 yen, is almost equal to $9 a month. That's a fraction of what the same person will pay a year later. It's not a foreigner discount, and it's not a loophole. Japanese citizens get the same treatment in their first reportable year, new graduates see it too. It's simply how a system based on last year's income treats anyone with no last year on record. The catch: it's temporary. Once you've completed a full calendar year of Japan-sourced income, that number gets plugged into the formula the following spring, and your premium jumps to reflect what you actually earned. Budget for the increase in year 2. Low first-year premiums aren't the only built-in discount. Japan also runs an automatic reduction system for low-income households, on top of the zero-income effect. Depending on total household income, the flat per person and per household charges can be automatically cut by 70%, 50%, or 20%, on a sliding scale. The lowest income households get the deepest cut. Here's the part that trips people up: automatic doesn't mean no action required. The reduction only applies if the municipality has your income data on file, including a formal declaration that your income was zero. Skip that filing and the system assumes it simply doesn't know your income. No reduction gets applied, you're billed the full flat rate amount, and if you ever need expensive medical care, your monthly out-of-pocket cap defaults to the highest tier instead of the lowest. A 15-minute form at the tax counter prevents all of that. Speaking of deadlines, you're required to enroll within 14 days of the trigger event, typically the day you register your address, or the day you lose employer coverage. Miss it, and enrollment is still possible, but 2 things follow. Premiums get billed retroactively to the date your eligibility actually began, up to 2 years back in the worst case. And any medical costs during the gap are generally your full responsibility, out of pocket. Now, historically, if someone just quietly stopped paying, enforcement was slow and inconsistent. That's changing, and the change is aimed squarely at foreign residents. Starting in June 2027, Japan's Immigration Authority will check your national health insurance payment record as part of visa renewal and status change screening. Unpaid premiums will, in principle, be grounds for denial. This lands harder on national health insurance enrollees specifically. If you're a salaried employee on employer insurance, your premium is deducted automatically, there's nothing to forget. If you're freelance, self-employed, or between jobs and paying this yourself, tracking and paying on time just became directly tied to your ability to stay in the country. What you get for all this? The same core coverage as employer insurance. Standard consultations, tests, imaging, surgery, hospitalization, and prescriptions are all covered at a 30% copay, plus a monthly cap on out-of-pocket costs if a serious illness hits. What you don't get: income replacement if illness keeps you off work, and no maternity income replacement benefit either. Employer insurance includes both. If you're self-employed and this is your only coverage, that's a real gap worth planning around separately. Put it together and the strategy is simple. Your first year here will look artificially cheap, don't mistake that for the ongoing cost. File your income declaration even if it's zero, so every discount you're entitled to actually applies. And treat the payment deadline as seriously as your visa paperwork, because as of 2027, it effectively is your visa paperwork. Next in this series, earthquake insurance, and a pricing rule so strange that no insurance company in Japan is allowed to compete on it. National health insurance in Japan isn't expensive by international standards, but the bill you see in year 1 is not the bill you'll see in year 2. Know which year you're in before you budget. Subscribe for the rest of the insurance series, and for more data-driven breakdowns of the real cost of living and investing in Japan.
And that's today's breakdown. If you're serious about real estate or moving to Japan, research like this is exactly what separates a smart decision from an expensive mistake. Subscribe so you don't miss the next deep dive, and drop a comment if there's a city or word you want us to cover next. Thanks for watching, and I'll see you in the next one.